When I was diagnosed, they told me within 5 years, everything would be cured. And I was 17, sitting in a hospital a week before my prom. And I thought, okay, 5 years, I can get through that. The reality of living with insulin was a pretty cruel one for me.
As Joey returns to the University of Chicago for her monthly evaluation following an experimental islet cell transplant, she is reminded not only of how far she has come, but how her journey from insulin dependency began.
Pancreatic islet cell transplantation is an experimental procedure that removes islets from 1 to 2 deceased organ donor pancreases and transplants them into an islet cell transplant candidate. Patients receive about 10,000 islet equivalents per kilogram of body weight once they are purified and processed, and once the cells are implanted, they begin to make and release insulin. The overall goal is that this procedure will help people live without daily insulin injections.
The main goal of islet cell transplantation is to effectively control blood glucose in type 1 diabetics. It does this by maintaining tight control of insulin levels, avoiding hypoglycemic episodes, and improving hemoglobin A1C levels. Because islet cell transplantation is an evolving technology, some issues include low islet isolation success rate, difficulty in maintaining an insulin-free status, side effects of immunosuppression from anti-rejection drugs, and a donor shortage in some countries.
Researchers use a mixture of highly purified enzymes to isolate islets from the pancreas of a deceased donor. Collagenous solution is injected into the pancreatic duct. Delivered this way, the enzyme solution causes distension of the pancreas, which is subsequently cut into small chunks and transferred into the Recordis chamber. Isolated islets are then separated from the exocrine tissue and debris in a process called purification. During the transplant, a radiologist uses ultrasound and radiography to guide placement of a catheter through the upper abdomen and into the portal vein of the liver. The islets are then infused through the catheter into the liver.
Islet scientists work for 3 to 4 hours and do a special process where they isolate the islet cells. Those are the cells that make insulin. And they separate those away from the rest of the pancreas and put those cells into a special solution in an IV bag. And then that IV bag is brought back to the patient now 4 hours later. So they're through with their surgery, they're in the ICU, and we're carefully managing their blood sugars and keeping them stable after surgery. We bring them back and we meet the patient meets their islet cells in the radiology suite, where they then undergo infusion of the cells. The way that they infuse them is they go in through the patient's side into their liver with a catheter. And the catheter, we use the catheter to put the islet cells into the portal vein, which then leads to the liver. The islet cells then set up shop in the liver and start to make insulin, usually in 1 to 2 weeks' time.
In patients with end-stage renal disease, successful transplantation will improve glycemia and may improve kidney survival. Also, patients with a history of frequent, acute, severe metabolic complications such as hypoglycemia, marked hyperglycemia, and ketoacidosis are eligible for transplantation due to the incapacitating clinical and emotional problems associated with exogenous insulin therapy and consistent failure of insulin-based management to prevent acute complications.
With all transplantations, the risk of tissue rejection is probable. This is a frequent occurrence and a main concern with islet transplantation. In order to prevent rejection, recipients must take immunosuppressive agents. The use of these agents increases the possible risk of anemia, fatigue, hypertension, renal dysfunction, infections, and gastrointestinal ulcers.
Joey acknowledges her role as a pioneer in cutting-edge diabetes research and its impact on those facing similar challenges in their daily lives.
Very important year for islet transplantation because the first results from international trials and experience worldwide are clearly indicating that clinical results long-term of islet transplantation have been improving steadily. Now we have the results at 5 years have more than 50% of the patients that can still maintain insulin independence following an islet transplant.
Since 1999, islet transplantation data from North America, Europe, and Australia were submitted to the Islet Transplantation Registry. As of 2008, 325 patients had received 649 islet transplantations Of these patients, 70% achieved insulin independency at least once. 71% of these patients were still insulin independent at 1 year. 52% were insulin independent at 2 years. Islet transplantation markedly reduced the occurrence of severe hypoglycemic events from more than 60% before transplant to less than 10% after 5 years.
Happy tears, good tears, but yeah, I think it was beyond expectations. I would consider myself an ex-diabetic.
I feel limitless. I am too optimistic, too excited, but that's where I'm at in life. And you can't tie me down. And that's the person I like to be.